Let me add here, however, that in the now era of the vaccination, I have found that there is a sort of a misunderstanding that diabetics have as it relates to the vaccines. In fact, a lot of diabetics seems to think that because they have diabetes, they should not be vaccinated. In other words, they call diabetes an underlying condition, and to their mind, a diabetic of diabetes is an underlying condition and they should not take a vaccine. Well, nothing could be further from the truth. The fact is the COVID-19 virus kills ravishly persons who are diabetic. If you look at the amount of persons who died from the COVID virus, many of them are diabetics. And so because of this, I've had to explain to the audiences that because you're diabetic, it means that you are at increased risk of dying from the virus. And as a result, you should be front of the line to get your vaccine because you need to protect yourself as much as possible. We've also found a very interesting scenario that we're now trying to figure out what's really going on. And maybe it's easiest if I give an example. I had a 32-year-old male who tested positive for COVID. And within a few days, he developed a very serious complication and had to be admitted to hospital for COVID-related complications. Well, in the hospital, the first strange thing that happened is that his blood sugar started to go up. Now, when people are sick, normally your blood sugar goes up anyway because that's a way of the body responding to sicknesses. But his blood sugar went up to the extent where he was actually diagnosed with diabetes. And not just diagnosed, he was diagnosed to the extent where he actually had to be put on treatment for diabetes. When he left the hospital, of course, he had a diagnosis of diabetes. That was an interesting discovery. By then, I took note of what was happening and found out that there were some other persons who were experiencing similar issues. They were not diabetic, or they thought they weren't diabetic, or maybe to put it most scientifically, their diabetes was not diagnosed. But after COVID infection, they now are outright diabetics. So that's one example. A second example is people who have been diabetics before becoming COVID-19 positive or hypertensive before becoming COVID-19 positive, well controlled on diet or medicines before COVID-19 infection, suddenly find themselves in a situation where after they've been infected with COVID, they are now unable to control their blood sugars or unable to control their hypertension. I have seen this scenario play out so many times, which brings me to a sudden realization or probably conclusion, if you want to put it that way, that COVID-19 seems to speed up or exacerbate things that you've already had in your bodies. So to my mind, these newly diagnosed diabetics were people who probably were pre-diabetic before COVID infection, or persons who were at high risk of becoming diabetic prior to the COVID infection. And they probably did not know because maybe many of them did not get their blood test done and their HbA1c. And so COVID simply sped up the diagnosis of diabetes. And I'm realizing that COVID seems to be a virus that does that type of thing. I had another friend who have had a long-standing, very dangerous medical condition that he always knew he was at risk of having because of the high probability and the high prevalence of it in his family. So he was very aware that this is something that could actually happen to him. And after becoming COVID-19, exposure to COVID-19, the condition showed up itself. That's an interesting scenario that is playing out for us here. And that's one reason why we need to be very careful. We need to make sure we control our blood sugars and pressure as much as possible. So for those of us who are diabetic, and I'm not diabetic yet, so maybe I shouldn't say those of us, but I know I'm at risk of diabetes because everybody on my mother and father's side, uncles and aunts, everyone has diabetes. And I know my own generation, my older cousins are diabetic, so I know I'm at risk of it. But we just need to understand that if you're diabetic, no matter what conditions you have, COVID-19 tends to exacerbate these types of things. And viruses tend to do that because I did remember saying sometime before that even in the days of the chikungunya, we have found that people who have had chikungunya continue to have complications of the chikungunya up to 3 years after the chikungunya has gone. So if you're diabetic and your kidney function is on the borderline, or maybe your cardiovascular system, your heart, you're on the borderline of heart failure, and so many times diabetes come with the famous triad, I like to call them. So most diabetics would have hypertension as well as high cholesterol. And those with high cholesterol tends to have hypertension and diabetes. And those with hypertension tends to have diabetes and high cholesterol. So those famous three tends to go together. And so what we're seeing for some diabetics who may have had good control pressures or who may have had good control cholesterol, suddenly after the infection, after getting COVID infection, these diabetics now start having these two other conditions, which are cholesterol problems and hypertension problems. So again, it's yet another reason why we have to take these whole COVID-19 infections so seriously as it relates to diabetes.